Hey there, I want to take a minute to talk to you a little bit about anti-aging and facial rejuvenation. So in my practice, my approach to anti-aging is multifaceted. There are three critical areas that we address. First is really what we call prevention, and that's involving non-surgical injectables and other skincare-based products to prevent aging. That can be done at any age, any type of patient. They come to us and they ask, what are the vitamins or supplements I should be taking? Should I be getting Botox? What are the other interventions, skin creams that will really make a difference? The second category is what I like to call intervention. And those are patients that are coming to me for non-surgical or maybe minimally surgical interventions. Those are patients that are getting radiofrequency-based microneedling, like Morpheus 8 or Profound. Those are patients that are getting lasers for skin resurfacing, and broadband light or intense pulse light, IPL or BBL, to improve the browns and reds of their skin tone. There are other categories that fall within this intervention category to improve the quality of patient's skin and to intervene in the aging process. The last category is really the most important in my practice. That's reversal. So we have prevention, intervention, reversal. Reversal is a surgical approach to go in and turn back the hands of time, 10, 15 years, by doing a surgical procedure to address descent of the brow, descent of the eyelid, heaviness of the mid-face, the jowls, and the neck. The most common place is the neck because aging occurs in the cheeks at the same rate. If one cheek hangs 10% and the other hangs 10%, 20% of it gathers here. So this is the most common place where patients come to me and talk about their aging. And it's also the place where I judge the quality of the result the most, because the neck is the place where all the results show. My approach to facelift in general is a deep plane approach, where we're making an incision in the skin, then going to the deep layer of the fascia that's above the muscles of movement of the face, and releasing all of the tension in the mid-face and the jowl, in the cheek, and across the nasolabial fold. Once the tension is released, we reset the face to where it belongs. It's a lift, not a pull. So we're allowing the skin and the fascia to go back where it belongs, and then we just remove excess skin. If the skin isn't pulled and it's not placed under tension, and tension is what creates a scar, then there's almost an invisible scar in the incision around the skin when we're done closing. And again, that's because all the tension is placed on the fascia that's below, the SMAS layer, that deep plane of fascia that we're elevating back to where it belongs. That helps to correct jowls, descent of the mid-cheek, and the nasolabial fold. For the upper face, we do the same approach to the brow to reset the brow with an endobrow or open brow approach. And we also do eyelid surgery to remove extra skin that hangs or hoods over the lids and weighs them down and makes them heavy. One other critical intervention that I like to do is to address the upper lip. I perform a modified deep plane lip lift, which is something popularized recently in Beverly Hills, which allows us to release from here all the way to the corner lip on both sides, and then to reset the lip to a more favorable position. This alone can totally de-age or reduce the aging that's seen in the perioral and mouth regions. My approach is to always do a surgical procedure first, and then in the following 6 weeks to do other interventions, including at 1 to 2 weeks Botox to soften the wrinkles of the forehead and around the eye, to prepare the patient for a laser that's done between 3 and 6 weeks. That laser can then be done without any wrinkles, any movement, any signs of wrinkles. So when it heals flat. That's one of our trade secrets. The next step is after the laser heals, 3 to 5 days after, to go back and do a little bit of filler to tweak some of the areas that we want to tweak, fine tune the adjustments, and to address some of the other areas of deficit, perhaps a little bit of emptiness in the earlobe, perhaps a little bit of hollowness in the lower mid-face, lower jaw and mid-face. Then in the end, we go back and do other subtle refinements. Maybe at 8 weeks out or 12 weeks out, we do a microneedling with radiofrequency like Morpheus or Profound in order to shrink wrap the neck better and deal with the skin after it's gone through the swelling from surgery and the laser. All these approaches lead to an anti-aging platform and a surgical intervention, which I like to really consider an anti-aging experience. That's not just surgery. It's also focused on all the other non-surgical interventions. The last thing that I'd say is that I also have a nutritional approach where we use a special wound healing product called Juven, which is designed to help around the surgical procedure, but then an anti-aging medication that's designed by doctors in a company called HealFast that's all clinically proven to help maintain the quality of the skin later on and through the rest of your life. We also talk about antioxidants, N-acetylcysteine and glutathione being the key ones, which we'll chat the most about, and NAD for anti-aging going forward. Finally, the last most important thing that we discuss is facial massage after surgery, lymphatic drainage, and maintaining the quality of the skin over time through different techniques. If you want to learn more about anti-aging and about the process and my approach to the facial rejuvenation procedure, surgical, non-surgical, and other types of interventions, then check out more information on my Instagram account or on the YouTube page.